you could help us unpack or maybe walk through the process of how you work with medical device companies. I think that'd be really helpful.
There's three main ways we work with a medical device manufacturer. And this is really where they are in their development cycle or funding cycle to typically tie together. The first is we have a secure medtech design consulting service. This is where a manufacturer, if they're in Series A funding typically, and they're developing the product or trying to iron out the requirements, we will help them design cybersecurity into the device. Because all the regulatory authorities require what's called a secure product development framework. They want security designed into the device, not bolted on at the end. So we help them with those design decisions because we realize most software developers are worried about functionality, and we help infuse that cybersecurity lens into the development process. That's the first part. Later on, typically 6 months is kind of the sweet spot before a submission for, let's say, a 510K in the United States with the FDA. We work with the manufacturer to do all the documentation, all the testing, and all the analysis so we can work with whoever's submitting their package and provide them everything required for the cybersecurity requirements by the FDA. And once the device is cleared, and we guarantee our clearance as well, we work with the manufacturer and guarantee our work. So if there's any additional information request or a deficiency letter, we've never received one of those, we will make sure we address that. And then once the device is on the market or is cleared, we then do post-market management. That's an annual contract where we look for new vulnerabilities. We set up a vulnerability disclosure portal where somebody can log a vulnerability if they discover it. We do triage. If there is a vulnerability reported, we run it to ground to make sure it's a true positive versus a false positive. And we work with the manufacturer to help update the device and keep it secure. So basically, we look at the full product lifecycle from the inception until disposal, and we can work in any of those areas.
So it sounds like to me, Christian, that companies in the medical device industry should work with you as soon as possible, like at the very beginning of the medical device product development cycle.